Heart failure management part 2. Other medications used for heart failure management apart from the 4 pillars. Good morning and welcome to today's episode. The 4 pillars form the basis of heart failure management. We discussed this yesterday. ANIs, beta blockers, MRAs, and SGLT2. They form the foundation of heart failure management. However, some patients require additional medications to manage symptoms, prevent complications, or treat the related conditions. So let's walk through these important medications and why each one of them matters. Number 1 is diuretics, or what we call the water tablets. These medications help your body get rid of excess salt and water. They ease swelling and shortness of breath, and they work quickly to relieve congestion and bring comfort, enabling you breathe better and move easily. We use them to relieve symptoms such as fluid overload, edema, or breathlessness. And the examples of these drugs very commonly used is furosemide or Lasix and toracemide. Note, these are used only when you have fluid overload, edema. The diuretics make you feel better, relieve symptoms, but they do not reduce mortality in heart failure. That's why doctors will keep adjusting them and avoid dehydration. So diuretics used for fluid overload. Class number 2 is the digitalis or digoxin. This is also not among the 4 pillars. Digoxin is only used in heart failure with reduced ejection fraction, especially when the symptoms persist despite the 4 pillars. So you are on 4 pillars and you still have symptoms, or you don't tolerate the 4 pillars, then digoxin is added on. It is also used, number 2, when there is atrial fibrillation, problem with the heart rhythm, and your beta blockers cannot control the rate. So in this class we have digoxin. It helps the heart beat more efficiently, increased contractility, but requires close monitoring. Again, it only improves symptoms, does not reduce mortality. So not among the 4 pillars. So if you don't respond to treatment or you have fibrillation. Class number 3 is anticoagulants or the blood thinners. They are also not indicated purely for heart failure. So when do we use these drugs? These drugs are important for preventing clots or even stroke in some patients. So when do we use anticoagulants in heart failure? We use in patients with heart failure plus atrial fibrillation to prevent stroke. Heart failure with AFib. Number 2 is heart failure with an LV thrombus, with a clot in the heart. Then you are put on anticoagulants. You can also use them in heart failure when you are using them for prophylaxis to prevent you from getting a clot, but they are not purely indicated for heart failure. And currently we use the DOACs, the newer ones, the dabigatran, apixaban, rivaroxaban. Remember, routine anticoagulation is not indicated in heart failure apart from the cases we have said, an LV clot, AFib, or DVT prophylaxis. Class number 4 are antiplatelets, aspirin. So aspirin is not indicated purely for heart failure. Aspirin is only used if there are other cardiovascular conditions that require aspirin. For example, coronary artery disease, if you have had a previous heart attack, blocked arteries, if you had an ischemic stroke, or peripheral artery disease. So aspirin does not improve heart failure outcomes on its own, but it is only used if there is an indication for aspirin, atherosclerotic cardiovascular disease. Class number 5 is statins or cholesterol medications. Once again, cholesterol medications are not indicated purely for heart failure. So when do we use the statins or cholesterol medications in heart failure? We use them when heart failure is of ischemic origin, heart failure due to blocked arteries. We also use them for patients with high cholesterol or patients with atherosclerotic cardiovascular disease. They help stabilize the plaques and protect against heart attacks or strokes, but they are not used for heart failure of non-ischemic origin or without those risk factors mentioned. Very key, iron therapy and supplements. Can you use supplements in heart failure? Iron deficiency is very common in heart failure, even without anemia, and it can worsen fatigue and breathlessness. So currently it is recommended for every patient with heart failure to check the ferritin levels, and if they are low, iron supplementation. It is recommended to use IV iron like IV ferric carboxymaltose, which is better than even the oral iron. Iron therapy can improve symptoms, exercise capacity, and quality of life, and it has been found to reduce heart failure hospitalization. Other supplements should only be given if there is a deficiency. So always check the levels, check the calcium, check magnesium, check potassium, and if they are low, you can supplement at that time. Omega-3 have also been found to have minimal benefit in heart failure. So note, for all other supplements, they are not routinely recommended for heart failure. They have not been shown to have any benefit or impact on outcomes of heart failure. So supplements without deficiency, no evidence that they improve heart failure. So all these medications, diuretics, digoxin, statins, aspirin, anticoagulants, when used together with the 4 pillars, so the other drugs are used when they have an indication. They relieve the symptoms like swelling and fatigue. They prevent complications like stroke, heart attack, and enhance quality of life. Remember, we said heart failure management requires many medication. Every medicine has its own part in the treatment of heart failure. And when taken regularly and faithfully, they all work together to strengthen your heart. Heart failure treatment is a journey. It's not a one-day episode. So take your medication as indicated by your doctor. So stay tuned for the next important episode where we will discuss still more on management but devices in heart failure. Sometimes medicine alone is not enough and the heart may require a lot of support. We'll discuss pacemakers, CRTs, ICDs, and LV assist devices. So stay tuned, share, like, and follow not to miss any episode. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.